Thank you, everyone, for being here today. I'm going to start with the COVID numbers. The state's numbers as of yesterday, 2,225 new confirmed cases, bringing the total from the beginning of COVID cases in Massachusetts, 204,060. There were 20 new deaths reported yesterday, bringing the total deaths in Massachusetts 10,319. In Boston, as of yesterday, we had 187 new confirmed cases, bringing our total in Boston to 25,962. We had one new death yesterday that was recorded, bringing our death total to 903. And during this Thanksgiving season, we just want people that have family members or sick and suffering from COVID-19, let you know you're in our thoughts and prayers. And for all of the families that won't have their loved ones with them tomorrow, we want to pass along our condolences to all of you for tomorrow. Testing for the week ending November 20th, we had an average of nearly 4,800 people tested each day. That's up from 4,000 the week before, so we're definitely seeing increase in testing happening here in the city. That does not include the college testing, which would more than double that number if added. So we took the college testing out. We are tracking it, the college testing, but we're not inflating numbers as far as testing in the city of Boston. I want to take a moment to thank everyone who's taken time out of their schedule to get tested. I know many people wanted to get tested before Thanksgiving. We don't want people to think that a negative test results allows you to have a normal Thanksgiving, and that's something that's really important for people to understand. You must still take precautions, which I'm going to talk about in my remarks today. But we expect and encourage this interest in getting testing to continue, and we're encouraging people to please continue to get tested. Again, I want to thank the press who helped us begin the process of getting word out on testing about a month and a half ago. I appreciate it. It's really worked well, so thank you for that. We continue to work on expanding our testing capacity, especially in our communities with the highest rates of infection. Our free mobile testing sites are open today and this Saturday in East Boston at Central Square Park, in Mattapan at Jubilee Church. And we're working right now on adding a third mobile testing team that we can move around the city of Boston. We'll have more details to come sometime next week or the week after as we continue to put this together. Currently, we have over 30 testing sites in the city of Boston. You can find them listed and mapped at boston.gov/coronavirus, or you can call 311. And just to remind everyone, you do need to call ahead to schedule a test. Positivity this week, ending November 20th, the average number of positive tests for each day for Boston residents was 215, which is down from the previous week, 245. Our current community positive spread was 4%, down from 5.6%. No neighborhood had community positivity over 8%, although 7 neighborhoods were over 5%. Every neighborhood saw positivity rates go down except for Mattapan, which had a really small uptick. Our tests were up and new cases were down for the first time in several weeks, actually first time in about 5 weeks. So it's good signs, encouraging signs as we think about where we are. And I want to thank everyone. We just need to keep it going. We need to continue to take the precautions that we need to do, and especially tomorrow with Thanksgiving, we want to make sure that people take care of yourself, and we're encouraging you to stay in small groups and stay in your own family unit. Overall, the data continues to tell us that viral transmission is happening in every community. Each of us are at risk of infection. Our older and medically vulnerable relatives continue to face higher risks of severe illness. As a community, we face the collective risk of surges in cases happening over the winter, so we have to work to keep that down. We're seeing what it looks like at hospitals in other parts of the country right now, and we have the power. All of us have individually have the power to prevent this from happening here, but we must continue to work together to keep those numbers down. Because of the recent trends, we're not going to move into step 2 of phase 3 in the reopening plan, despite spending 3 weeks out of the red zone on the state map. We need to continue, and we're going to continue to take cautious approaches to get our numbers going down consistently. We just need to continue to see these numbers going down. Our first line of defense is personal precaution that we can all take. In the workplace, in the car if you're carpooling, on public transportation, buses or cars, in stores or public spaces, at home, and especially tomorrow on Thanksgiving. I know most people have already made plans, but I want to just mention again what everyone should be focused on. Please celebrate in person only with members of your current household. If you plan to gather in large groups, I ask you to reconsider those plans. If you do gather, I ask you to take steps to minimize the risk of the transmission. Have this conversation now with your family, if you already haven't, so everyone knows what to expect. Keep it small. 10 people is the limit indoors. We're asking people, you should wear masks if you're around family members that you haven't seen in a while. Wear a mask in the house. When you obviously sit down to dinner, you take the mask off, but when you're in the house, you really should wear masks. We're asking you to physical distance. Don't be sitting on couches and next to each other if you haven't been around the people and you know the people around you where they have not been. We're asking you to constantly wash your hands and wash down surfaces as much as possible during the day tomorrow, and you should do this all the time. If it's possible, eat outdoors. Open the windows and doors in your house. The forecast is 57 degrees with rain, so getting fresh air circulating through your house or your apartment is really, really important. Have one person serve the food, wearing a mask and gloves. Do not share food, drinks, or utensils. Think especially about your older relatives. This really is about older relatives and people with medical conditions and making sure they stay safe. It would be terrible. It would be a terrible tragedy to see outbreaks driven by family gatherings cause people to get sick and potentially lose their life during COVID. So it really is important that we take this very seriously. Update on small businesses. It's been a very tough time for our small businesses here in the city, in the Commonwealth, and quite honestly in our country. We've been adding new and existing supports available here in Boston. This weekend is Small Business Saturday. We made a special push to highlight our neighborhood commercial districts so people, when you do go shopping, to shop in your neighborhood districts. We won't be doing those events in person this year, but we are doing more than ever to help our small businesses try and get through this very difficult time. So far, our Small Business Relief Fund has distributed over $6.7 million to 1,900 businesses in the city. Our Reopen Boston Fund, which provide grants for safety materials, has distributed $3 million in over 1,500 grants to businesses in the city. Those funds, and to continue to get those funds, we're still taking applications. You can go to boston.gov/reopening, any small business interested in trying to secure some of these grants. Last week, our 3 new relief funds took over 1,600 applicants for grants. 1,000 of those were for commercial rent relief. So far, we've had 330 landlords complete their part of the application, which closes on this coming Monday. I want to just thank all the businesses and landlords for working with each other and working with us, and I encourage others to do the same. These funds are set up to help our small businesses. I also would ask everyone, as the holiday season begins, to look for ways that you can safely support our small businesses in your areas, in the neighborhoods in the city. We're putting in place some transportation opportunities that can help us do that. Starting this weekend, we will have free 2-hour parking in all of our commercial districts every Saturday through the end of the year. It's a way to encourage more people to visit and patronize our local businesses. That means meters will be free, 2-hour parking. We also have holiday discounts for Blue Bikes, the bike share program. This Monday, we'll be offering a 30% discount on annual membership. We still have free 90-day passes available for frontline and essential workers to access. While the weather holds up, it's an opportunity to take advantage of the new bike lanes and visit our local businesses all throughout the city of Boston. For our restaurants, we have plans to continue an outdoor dining option. The public space program ends on December 1st, which is next week, but outdoor dining may continue on private property indefinitely. In addition, we're working on outdoor dining programs for the spring. We're going to be sharing more details next week about the program that we will have next spring for outdoor dining. We remain committed to providing restaurants with opportunities to help them survive and succeed. And we're committing to building back better, a better normal. During the pandemic, 54% of all of our small businesses we have supported are owned by people of color, reflecting the diversity of our city. This Monday, we launched a Reimagine process in our Main Streets program as a vehicle of recovery that helps close racial gap divides. We continue to use the Boston Resiliency Fund to support our most vulnerable neighbors. We face tough winters here in Boston, and we have neighbors with deep needs. We need to be there for them as a community with health access, food access, housing supports. The essential people need to stay safe. The Boston Resiliency Fund has made all of this possible. We've raised over $33 million, and we continue to get those resources into the hardest hit communities and into the hands of our most vulnerable residents. This week, we distributed nearly $1.8 million to 17 local nonprofits. 70% of this week's grantees were led by people of color, and 76 led by women. This week, we are funding support systems for students in remote learning, led by Boston After School and Beyond, and I want to thank After School and Beyond for the incredible work that you're doing in the city of Boston. This is a network of safe, trusted child care programs, reaches out to 6,250 students in our highest needs communities, which include Chinatown, East Boston, Roxbury, and Dorchester. They allow students to learn remotely from schools, but in a safe, supporting environment, while parents and guardians go out to work. This is the way we can support students during remote learning through the work of some of our wonderful trusted community partnerships. They include the Greater Boston YMCA, the Boys and Girls Clubs, East Boston Social Center, and other great organizations in our city. Other grant supports telehealth for seniors, mental health supports for immigrants, testing, healthcare access, wellness checks for seniors, and others in Boston's Black community. The Boston Black COVID-19 Coalition, I want to thank them for their incredible work as well. And always fresh foods and produce for families and seniors all across our city. That's where the money is going this week. The funds has now distributed over $29.4 million over 360 local nonprofit organizations in Boston. I want to thank all the organizations that have done amazing work in the city of Boston. We are still taking donations, and you can learn more if you go to boston.gov/resiliency fund. Usually during Thanksgiving, I spend the day serving food at homeless shelters all throughout the city. Obviously this year that's going to be a lot harder because we can't bring extra people into our shelters. I'll be at an outdoor event with Pine Street Inn, and we should all keep the homeless and hungry in our hearts and in our minds. We've seen unbelievable outpouring of support and generosity this week under very challenging circumstances. For example, we have free turkey care packages with food and other essentials for young people ages 13 to 24 experiencing homelessness. If you're a young person and you know a young person you could use help, contact us here at the city. But you can also, care packages are available to pick up at More Than Words bookstore on Berkeley Street in the South End until 5 o'clock today. So I want to thank More Than Words for your incredible work. I just want to give a shout out. Yesterday we were at a turkey drive. Representative China Tyler had one in Roxbury. I want to thank Representative Tyler and the young people that helped with that drive yesterday. It was amazing to see so many different organizations in our city come together and different people doing great things, so thank you for that. On the onset of winter begins, additional safety concerns are compounded by COVID-19. So we have a plan in place to make sure that our homeless neighbors are safe this winter. This year we brought on additional shelter sites to de-densify existing shelters during the pandemic. As we head into winter, we're going to anticipate the need for more capacity in our system. So we have secured capacity of an additional 200 beds of emergency shelter, including beds for women, men, and young adults. I want to thank our staff and our partners as well. St. Francis House, Boston's Rescue Mission, Pine Street Inn, Bridge Over Troubled Waters, the New England Center for Homeless Vets. Thank you, all those great organizations that have been doing amazing work here in the city of Boston for long before the pandemic, but in particular during the pandemic. I also want to remind anyone and everyone to call 911 when you see someone in distress who may be without a home or outdoors for any reason that you see they're in trouble. Call 911 directly. All of this work goes beyond the holidays. Caring for the homeless means fighting to end homelessness. And we work to keep our residents safe and housed every single day. So far during this pandemic, we have gotten permanent rental vouchers in the hands of nearly 1,000 families with children in the Boston Public Schools who are at risk of homelessness. We launched it in front of City Hall in the beginning of the pandemic, and we were able to get those vouchers out to families. We provided permanent housing to over 200 individuals who are chronically homeless. Since 2015, we've built 2,250 units, or we've created 2,250 units of permanent housing for homeless people. In addition, we helped more than 100 young adults who previously been homeless secure housing. That work was part of our plan to end youth homelessness and young adult homelessness in partnership with dozens of organizations, including Bridge Over Troubled Waters. We have also distributed nearly $4.1 million in rental relief to nearly 1,200 households that were at risk of eviction. We've made $8 million more available, and we're in the of processing hundreds of applications right now. This work is keeping thousands of people in their homes, and remains great that we can do that. And with housing court open again, I want to share a message to those who may be facing eviction. We have funded an attorney from Greater Boston Legal Services to work with you free of charge at Boston Housing Court. When you are summoned to court, we're asking you to request access to that service. We have been advocating for the rights to free legal counsel in Massachusetts. In the meantime, we have used the funds from our anti-racism investment to provide free counsel. We want to make sure that you can access those resources. I also remind everyone that the federal CDC moratorium on evictions remains in place for those impacted by COVID-19 until December 31st. But you need to present a declaration of need in housing court to get access to the moratorium. We've created a simple template that you can print and sign at boston.gov/housing stability. We're asking people to spread the word to help people access this document. The reality is this is a national issue. Across the country, the pandemic is hitting communities harder and harder than ever. And on January 1st, when the CDC moratorium ends, we could see a spike in homelessness. So we need Congress to act now, act decisively to prevent yet another public health disaster from devastating the American people. I know that there are lots of distraction in Washington right now, but there are always distractions. There is nothing to stop Congress and the outgoing president from taking action. So we're asking Congress to do that. Our delegation here in Massachusetts has truly been amazing, working up and down from coast to coast here, or from the coast to the west here in Massachusetts. So we're just asking people to do their job before this session ends. I was on a virtual event last night that featured Dr. Anthony Fauci, director of the National Institute of Infectious Disease. It was hosted by Reverend Liz Walker of Roxbury Presbyterian Church and Reverend Dr. Gloria White Hammond from Bethel AME. The purpose was to bring health awareness and information to the community. It was a great conversation, and Dr. Fauci showed why he is so respected. One of the things he said is, I'll just wait for this ambulance to go by. One thing he said was what allowed him to do his job in the midst of so much political noise was to focus on his primary purpose and responsibility, to protect the health and safety of the American people. Everything else was secondary. That's a great reminder to all of us, including Congress, of what we should be focused on, what we should be doing, and how we move our country forward and help the people that are struggling the most. Before I open up for questions, I just want to end by thanking all Bostonians. I'm grateful for you. I'm grateful for the opportunity to serve as your mayor. I'm grateful for the opportunity to serve every day to keep the people of Boston safe. I want to thank every single person, whether you're an essential worker, you're a grocery store worker, you're a nurse, you're a doctor, you're a first responder, you do janitorial services, you work at City Hall, you work at the State House, wherever you work. I want to thank you for the incredible acts of kindness and courage that we all shown this year. We will get through this together, and I just want to, again, thank everyone and wish everyone a happy Thanksgiving. I have one pre-question, and then I'll open up for questions here. A question from Kimberly Bookman at WHDH. There have been testing sites closed early today. Are you concerned that people will not have test results back in time to spend Thanksgiving with their family? Great question. The answer to that question is that a negative test result should not change the way that you approach Thanksgiving. You must and have to take all precautions regardless. We cannot test our way to a safe Thanksgiving. Our Thanksgiving guidelines remain the same. Suggesting that you only gather with current members of your household. Take a full range of precautions to go beyond that. It is true that health centers are testing more patients than ever before, so some people are thinking that this is safe to be able to gather. Honest to God, right now is not the right time to do it. So we're asking people to please continue to physical distance, social distance, do all of the things you can to keep yourself safe and the people around you safe. With that, I'll open up for questions.
In terms of restaurants and indoor dining, it sounds like the numbers are trending a little better right now. Do you expect that
question is, do I expect if the numbers if the numbers trend up, would I be thinking of shutting everything down, particularly restaurants? You know, the last 7 days we've seen a decrease. We're going in the right direction, at least for the first time in 5 weeks. If we continue in that trend, then there's no conversation about shutting things down. There's no conversation about shutting restaurants down. We actually can have conversations probably pretty soon about bringing people back into schools, things like that. We just need to continue to see that trend. There's been lots of rumors. I want to be very clear on this. There's been lots of rumors. I've gotten lots of calls that we're going to shut restaurants down. We're going to shut them down Monday. We're going to shut them down Friday, shut them down Saturday. We have no intention on shutting down restaurants in the city of Boston as of right now. Now, a week from now, if we're in a different place, if our hospital system is stressed, if the numbers continue to go up, we might have a different conversation. But as of right now, we have no plan to shut restaurants down. As a matter of fact, seeing the last bit of average here is encouraging that we're seeing the numbers go in the right direction. We need to continue to see those numbers trend in the right direction. So the outdoor spaces for restaurants, so I'm clear on it. If you are a restaurant and you have private outdoor dining, meaning that you have a piece of land that you own, that you have outdoor dining, we're going to allow you to continue that. You contact the license department. If you're a restaurant that uses a sidewalk, a public sidewalk, or public street, that program ends on December 1st. What we're going to be doing is we're going to be having a meeting. We're having meetings now, actually. And next week, hopefully, I'll be able to announce about the spring, what the spring is going to look like. We will have outdoor dining next year, but we're going to have a talk. I'll be able to explain more how we're going to do it as far as next spring, what the date is, and things like that.
Sherman's first question. These numbers do seem better this week than the previous. What do you think it makes that?
So Sean Carter from the Herald said that the numbers seem better this week. They do. They are better. I think there's a couple things going on here, and I'll let Marty jump in as well. Number one, people are listening, and we're doing what we need to do. When I say listening, they're not listening, but they understand the importance of wearing a mask, the importance of physical distancing, the importance of washing hands. More and more people are doing that. I'm looking out now at City Hall Plaza here. There's about 15 people in front of me. Everyone has a mask on. A woman's walking by now with a mask on. It's great. I think more people are wearing masks. Number two, I think that, you know, when the governor did the stay-at-home moratorium between 10 p.m. and 5 a.m., I said this a couple weeks ago, it's going to take a couple weeks to see if that has an impact. That could have an impact. You know, restaurants shutting down a little early, convenience stores shutting down, all of that, less gatherings, asking people not to gather more than 10 people in an apartment. We're getting less complaints on that. So I think more people are paying attention to the public health recommendations. Dr. Fauci's talking about it every day on TV, so people are hearing it. There's a direct correlation between physical social distancing, wearing masks, and being careful than not wearing masks and gathering. When more people gather, more people get sick and take the virus. So I think that all of the precautions that people are taking as individuals is big. My concern about tomorrow is that we, as family members, generally get together. We have no idea where your cousin or your nephew, we have no idea where other people have been in contact with. That's why it's so important to keep it to your immediate household tomorrow. You know, I see my cousins on Thanksgiving and, you know, my aunts and, you know, and different people. Tomorrow's not the day for that. Tomorrow's the day that I'm going to spend time just with my mother. And it's going to be a small little group of us, literally 3 of us. So I think it's really important that we continue to do that. And I think that's where we're seeing the downward numbers. I don't know if you want to jump in at all. I'll let Marty come up and talk a little bit about
it. Yeah, I mean, I think to the mayor's point, you know, it's pure data as part of it, right? We see a big increase in testing, which is important, and we see less people testing positive. So the metrics are moving in the right way, and the hospital metrics, as the mayor mentioned, are also not, you know, showing the capacity has been stretched yet. But I always am the voice of caution is that, you know, 1 week of data does not make a trend, right? And so the understanding is, can we keep doing all the things that the mayor pointed out? Can we keep social distancing? Can we do what's what's necessary as Bostonians to make sure that we can continue to see the decrease in activity and continue to go towards the things that we want to see reopen, towards the things that we want to see happen, like kids back in our schools and the ability to do that. So we need to just make sure we're looking for trends, and hopefully this is a trend in the right direction.
Are you seeing what is causing there to be fewer cases and that kind of thing? Like, is there less gathering, or?
No, I mean, the question is, are we seeing things in the data that tells us why, or it gives us a better sense? And not yet, right? I mean, again, to the mayor's point, this is the first time in 7 weeks maybe that we've seen any kind of decrease in positivity or number of cases. We do know more people are getting tested, which is really important. Just to give you a sense of that, maybe 3 weeks ago, on one of our mobile testing units in East Boston had tested about 800 people in a full week. This Monday, they tested almost 1,000. Right, so we've definitely seen an increase in the usage that we've been pushing, which I know is tough on the system. So that's important. But I think we just need to keep reminding ourselves that we got a long way to go through COVID, and we need to keep up all the precautions that people are taking on.
The rollout of the vaccine, which could be coming in a matter of a couple of weeks. What will the city be doing, and are you ready to step in and make it work?
The question is, what's the city's role in a potential rollout? Well, not a potential. When the vaccine does come out, what's the rollout? And we've been working with the state right now on plans on how it'll be rolled out. I think that having President-elect Joe Biden put his committee together, I think that his administration will probably be responsible for it and coming up with a real strong system on how do we get it from the federal government, how do we get it from the manufacturer, the pharmaceutical companies, depending who comes with the vaccine first, into the streets of America is going to be really important. It'll be a coordinated effort. So we don't have an answer on that yet, but we will be talking about that as we get closer. Also, we need to make sure that the vaccine is covered by insurance. If it's not covered by insurance, people won't get the vaccine, just like we're seeing with testing. Testing can be expensive, and lots of people can't pay out of the pocket to get testing, so we have to continue to work on that as well.
Has the Biden transition team been in touch with you about?
I actually had a meeting with the Biden, with President-elect Biden and Vice President-elect Harris last week with the U.S. Conference of Mayors. There was 65, 70 mayors on the call, and we were talking about, it was really refreshing to talk about issues that matter. We were talking about the vaccine and getting it out to across America. We were talking about the coronavirus. We were talking about housing policy. We talked about eviction moratorium ending on a federal level. We talked about unemployment benefits ending on a federal, ending in states and getting some help. We talked about infrastructure bills. So, if that was any idea of how this administration is going to work, I look forward to working with this administration as mayor for the many years to come. As mayor. Thank you.